My name is Alexis. I'm going to be Noah's nurse today. I'm going to help answer any questions before we start his chemotherapy. Noah or Mrs. Pillow, do we have any questions before we begin? I know this is kind of a rough and long process. Oh, no, you're a little more confused on what acute lymphocytic leukemia is. Okay, well maybe I can help explain that and clear that up for you. So acute lymphocytic leukemia is a cancer of your white blood cells. Your white blood cells are the cells that help defend your body against infection. What happens during this cancer is your body is producing immature white blood cells, and they're not able to function like the other ones are, so you can't fight off your infection. They make it so you're not able to produce any healthy ones either, so that it's really easy for you to get sick. Does that make more sense? Yeah, alright. And Mrs. Noah, do you have any questions on what's going on? Or anything about the whole process or anything like that? You're still confused on why he's here for this? Because he just came in for strep throat? Yep. Alright, so what had happened was we brought him in for strep throat. He get the antibiotics for it, and you still brought him in later, about 6 weeks, am I correct? Yep. Because he was still experiencing, because he still wasn't feeling right, correct? Okay. So, when you had brought him in, we had noticed that he was showing some signs and symptoms that were not accurate with strep throat anymore. We had still taken a throat culture just to be 100% sure that that wasn't affecting anything either, but your doctors and nurses had noticed that Noah here had some bone tenderness. He was kind of pale. He had an enlarged spleen and lymph nodes. Yeah, he was experiencing quite a bit of bruising, and he was having frequent nosebleeds. Now, these are signs and symptoms of acute lymphocytic leukemia. So your doctor had ordered a blood count, which is a way that doctors are able to diagnose leukemia. And from that, we were able to find out that he does have it, and we came up with a treatment plan for him that should help. For Noah's treatment plan, they determined that chemotherapy was the way to go. What chemotherapy is, it is entered into your body through an IV, which is a needle, which can be scary, but it helps kill off the cells, the immature cells that aren't doing their jobs properly. So in that way it can leave room for your healthy cells to help fight your infection and to help your body work the way it's supposed to. There are some side effects that come with chemotherapy, which can be scary. So we have, Noah may experience fatigue, some extra bleeding and bruising. He might lose his appetite. He might experience nausea and vomiting, and he can experience hair loss or mouth sores. No, you're wondering if there is any ways that we can help with these side effects. Yes, there is. If he is experiencing any nausea and vomiting, we do have some medications that can help limit that. If he has any mouth sores, if you use a mouth rinse, it can help reduce the irritation of it. You know what you should do if he's tired. Okay, so if he's feeling tired, we do recommend that he rests. We also want to encourage some activity when he's able to, just to keep his body moving. And what else is important that I forgot to mention was we have to look out for signs and symptoms of an infection. On chemotherapy, it is easier for Noah here to get sick. So if he's experiencing any fever or chills or a cough that just doesn't seem to go away, you should notify your provider, and that way we can get him in and figure out what's going on. And a fever is when his temp taking orally is above that, either 100.5 or 101, depending on what his normal temperature is at. Now I know this can be a very hard time for both of you, which there are some support groups or some different activities you guys can participate in that might help the situation. I know that they have a cancer support group at Trinity Lutheran Church on the first Wednesday of every month. And I know Senja Health here in Moorhead has some spiritual care and other support groups that either of you or both of you can attend. Any more questions before we begin the assessment? No? Alright, perfect. So now Noah went through his chemotherapy, and now he is back in a few weeks later, and we are going to figure out why. So hi, Mrs. Pillow and Noah. I'm going to be Noah's nurse today. I've heard that he's going to his chemotherapy regularly. Can you explain to me why we're here today? He has a fever and a cough. Alright, well, I'm going to be doing a examination of just some different things. Let's do his heart, listen to his lungs, and getting his temperature, weight, stuff like that to figure out what could be going on. Alright, so I'm first going to get his weight and height. Get that. Next, I am going to just kind of look around, look how he's looking. He looked a little sweaty from his fever, I'm guessing. I'm going to listen to his lungs super quickly to see what's going on here. I'm going to start with his back. Noah, could you take a deep breath in and out for me when I put the stethoscope on your back, please? Which I do not have my stethoscope, so we're just going to pretend. So deep breath in and out. Okay. Again. Again. One more time for me. Alright, perfect. Thank you. Now we're going to do the front. In and out. In and out. In and out. In and out. Perfect. Thank you. I'm also going to take his temperature again. Through the forehead. Write that down. I noticed during his breathing it sounded a little crackly, so I'm going to get the provider in here and see if we can get a chest x-ray.